Hi, my name is Kylie Christensen. I'm going to be performing the skill of administering a tuberculosis skin test and intradermal injection. I have all my supplies gathered. First thing you want to do whenever we are administering medication, we want to verify the orders and we want to check the 6 rights of administering medication. So the orders today are 5 TB units per 0.01 milliliters of tuberculin injected intradermal. I will verify that with the medication. And the 6 rights of medication are making sure it's the right patient, right dose, right time, right route, right medication, and right documentation. After I've done that, I will gather all my supplies and I will head to the room. When I'm gathering my supplies, I need to make sure I'm selecting the correct syringe. So it's going to be a 1 milliliter tuberculin syringe with a 5/8 needle on the end. And then I need to make sure I have the right medication, which is my tuberculin. I have gloves, 2 cotton swabs, and a gauze for after administering. After I do that, I will enter the patient's room and I will use 2 patient identifiers to verify the patient. I will close the curtains, perform hand hygiene. Hi, my name is Kylie. I am going to be your nurse today. Can you verify your name and date of birth? Perfect. Verified using the 2 patient identifiers. I am here to administer a tuberculin skin test. All that's used for is to decipher whether or not you have the antibodies or an infection of tuberculosis. If you do, you'll follow up with your doctor and they'll take it from there, but this is just a test we're going to administer. Do you have any questions about that? Alrighty, some common side effects is maybe some injection pain, burning, redness. You might see some slight bruising. Any adverse effects to this injection would be shortness of breath, maybe swelling of your airways or your face, or if you're having any hives or anywhere not around the injection site, we want to make sure we take care of that. Something to be aware of that we do just like to caution people on so they're not taken by surprises. There could be some slight stinging when we administer the injection. Okay, feeling okay about this? Perfect. I'm going to go ahead and pull up the orders in the computer. I'm going to check in there and then I'll be right back to get started. I'm going to pull up the orders. I'm going to see that it is 5 TB units per 0.1 mLs of tuberculosin, making sure I have the correct syringe again and the correct injection. I'm going to perform hand hygiene and then I'll put my gloves on. Alrighty. So now that I've verified for the second time in the MAR what my medication is, I will then go ahead and head over to my patient with the correct syringe, correct medication. Alrighty, so first thing I'm going to do is clean the vial. Alright, and then with my tuberculin syringe, I'm going to take it out. I'm going to withdraw 0.01 mLs of air. It's my 0.01 ml of air. I will take the lid off, inject the air into here. I am then going to flip this over and inject 0.01 ml of tuberculosis. I'm going to make sure there's no air bubbles. Perfect, so it's 0.01 mLs. Once I have done that, I'm going to carefully recap and set it down. I'm then going to go ahead and get the site for injection ready. So for this injection specifically, we're going to go ahead and choose the forearm. If the forearm wasn't a good option due to maybe a cut, a bruise, a lesion, or they had a vaccine of some sort on this arm, whatever you couldn't use, sites could be on the back, on your opposite arm, you would inspect. But for this one, we're going to go ahead and use the forearm. When administering a TB test on the forearm, you want to make sure it's 3 to 4 fingers from your anticubule and a hand from here. So in this part of the skin on the forearm is where I'm going to be looking. So before I get started with this patient, I'm going to go ahead and check and make sure there's no cuts, redness, swelling, bruising on the skin, making sure that this is a good spot. Once I have done that, I'm going to go ahead and clean it with an alcohol swab. After I've cleaned it with the alcohol swab, I'm going to let it air dry for just a little bit till the skin is clean and dry. After I've done that, I am then going to go ahead and carefully take the cap off of my prepared tuberculosin. When injecting a TB test in the arm, you want to administer it at a 5 to 15 milliliter. You want to make sure that the beveled edge is facing up so that the bleb forms on the skin. You want to be about 3 millimeters under the skin. So at a 5 to 15 degree angle, I'm going to go ahead and administer. First thing I want to make sure I do is pull the skin nice and tight. 5 to 15 milliliters. There should be a little bit of resistance. If there's not, chances are you're not in the skin. Once it's administered, once it's in the skin, I'm going to slowly administer then I'm going to put the gauze on it. We're not going to massage or rub it or anything. We're just going to put this here for comfort. If needed, you can apply a band-aid over the top here. Once you've done that, we're going to go ahead and use our safety on the needle, and we will dispose of this in the sharps container. Perfect. After that's been administered, we can throw the gauze away. I'll check in with the patient, make sure they're feeling okay, and let them know they can come back within the required time to have it checked for the second round. Besides that, I will dispose of this in the sharps. I will remove my gloves, take the medication with me, and perform hand hygiene, and then go document my results.